Okay, everybody, I did promise you that I would have a video concerning postmenopausal bleeding, which is what I'm going through right now. Now, I need to give you a little bit of background story. And the background story is not meant to upset anybody, so please don't think that's why I'm telling you. I'm telling you because it's important. Okay, it's important. Oh, the poo. She wants to chat. No, ma'am. You need to go lay down. Because it's important about the concerns. So, 2.5 years ago, my only daughter, who was in her 30s, was diagnosed with endometrial cancer and ovarian cancer. So we made it through that. She was actually staged at 1A, which is nearly impossible for ovarian. But hey, we did it. Okay. I don't know if many of you know that I am a teacher. My teaching expertise is in sonography. So when my daughter sent me the pictures, I said, I'm getting a ticket, I'm flying in, get an appointment with your doctor. And so we were able to then move to exploratory surgery, which she just closed her up, and then sent us to a oncologist, gynecologist, to do the major surgery 2 weeks later. So right now she's thriving, she's doing great, and she gets an MRI every 6 months. At the beginning it was every 3 months, but she still has no symptoms nor any signs of cancer. So that's all good stuff. Now, April of this year, 2024, my biological sister was diagnosed with endometrial cancer, which, remember, my daughter already have. And so I'm the only female left in the family. We have a very small family that has not had cancer. So I went to my doctor and I said, listen, we need to take another look in there. So they ordered an ultrasound. I had that done. And something some of you may not know is one of my graduates did it. So it was pretty cool because the lady that I taught to do ultrasound 5 or 6 years ago was the person doing my ultrasound. So that was kind of cool. So they've decided that I do need to have an endometrial biopsy and a cervical biopsy, mainly because there was some, inconsistencies in what a postmenopausal without hormone replacement therapy would have, and so the measurements were a little bit out of bounds. So that will be done in a couple days. Today's Wednesday, so next Tuesday I will have that done, and I'll try to upload another video of how that experience went. We did try to do it last week in the office, which I wasn't thrilled about. If any of you are offered to do biopsies, endometrial in the office, my suggestion, is say no if you have insurance, mainly because it is painful. So about 2 or 3 years ago, I had to have one, and I was naive. And so I let her do it in the office. Oh my God, it was so painful. But I got through it. And then I ended up having to go in the hospital anyways that year and have a DNC because there was a polyp in there. Okay. So this year we we looked at it last week and they said, we do not think it's a polyp. We think it's something more than a polyp. With the history of my daughter and biological sister, they decided, you know what, we need to go in there. I did allow them to try it again in the office. I figured I could get through the pain to have an earlier answer, and it just did not happen. So they put me on a medication until surgery, which is in 6 days. And the name of the drug is misoprostol. Okay, so it's really bizarre because I have to take it orally 2 days before and then vaginally one day before. So they gave me the pills, and I talked to the pharmacist today, and he said, yep, you got to do it orally. And he said, you will have cramps. You're going to feel like you're having a period. Um, and he said, and then the day before surgery, you have to put it in vaginally. So this is a whole new experience for me. And he said, just know you're going to have cramps. So I'm going to make sure I have a heating pad, you know, ready for my tummy or pelvic area in case I need it. And then, so Tuesday I go into my hospital here. And if you've watched my previous things, I use Harborview in Seattle. And so then I will have the cervical biopsies and the endometrial biopsies. And then we'll go ahead and go in there and clean everything out. And then we'll get the results and then make a decision if we need to proceed forward to a hysterectomy. If it goes to hysterectomy, I want a complete hysterectomy because at my age, the ovaries are not functioning anymore, and I don't want to keep something in there that might spar or, tumor growth. As you know, my daughter, who's in her 30s, had ovarian cancer, and she's doing well, so I'm not asking for sympathy here. I'm just saying my history of my child and my sister is enough to say, just take it all out, But listen, ladies, I will let you know what happens and my experience with having all this done, because I think it's important for us to know and understand what happens during these types of procedures. So, ladies, let's take care of our health in this region and let's get right.